morning. My name is Darian. I'm going to be your nurse today.
Nice to meet you, Darian.
You too.
I'm Jebediah.
Nice to meet you, Jebediah. Can you tell me what's brought you in here today?
You know, I'm having just a bad day. Just irritation in my eyeball. I can't see nothing. I look up at the lights and I see one of them, like I'm going to heaven, halos.
A halo
Yeah,
around the lights?
Mm-hmm.
Okay.
And the blur, I can't see nothing.
Okay. Did you have any sort of injury to your eye recently, or?
Well, I'm a lumberjack.
Yeah.
Let me tell you, I was out there working and I cut down this big old tree and there was just debris everywhere and, well, something got in my eye.
In your eye? Okay.
It did, and I tried to take the hose and clip. It didn't work.
No.
I feel like there's still some wood or something up in my eye.
Okay. Okay. And are you still feeling that pain? You still feel like something's stuck in there?
Oh yeah, definitely.
Yeah?
Oh, I don't feel good at all.
Oh, okay. Do you have any family history of eye problems, or?
Eye problems? Well, my nanny, Jezebel, we called her Jizzy for short. She had her eyeball always gray. Strangest thing I've ever done seen, but yeah.
Okay. Do you have a family history of diabetes?
Oh, we do. My grandpa, Ezekiel, he had that diabetes. Didn't do too well. He had a lot of, Jizzy loved to cook them fried pies, and well, Ezekiel, he just loved to eat him some pies. And me, I do have diabetes.
You do?
Just to let you know.
Okay.
Controlled though.
Controlled. Okay, that's good.
Yeah.
That's good. Do you take any medication?
That what you call metformin.
Is that all you take?
It is. Like I said, it's controlled.
Okay. Okay. We're gonna do a vision test really quick.
Okay.
If you don't mind to stand up. You can keep your glasses on for now.
Okay.
I'm gonna have you put this spatula over your left eye first.
Alright.
Alright, can you tell me how far down you can read?
Well, I know that is an E. I can see that.
An E?
And that FP looks, yeah.
FP?
Below that, I can't see nothing.
Okay.
It's too blurry.
Alright, now can you trade eyes for me?
I sure can.
Alright, now tell me what you can read.
Goodness, I don't see nothing.
Nothing?
Mm-mm.
Okay, now can we take your glasses off?
Sure.
Alright, now place it over your left eye again. Now tell me what you can read.
I know that's an E. That's an E. But below that, I can't
Nothing below that? Okay, now can you trade eyes again for me?
I don't see anything, darling.
Nothing? Okay. Alright. You can go ahead and have a seat, and I'm going to go talk to the doctor, see what we can do, and maybe send her in real quick, okay?
Alright, thank you, Dina.
Thank you.
Hey there.
My name is Dr. Gray, and who are you?
Jebediah.
Jebediah, nice to meet you. Can you kind of tell me a little bit about what's going on?
You know, I can't see too well. My eyes been bothering me. I'm a lumberjack.
I see that you got some pretty severe redness going
It's a
on.
little bit,
in
and
that
it's
left
just
eye.
a little bit. And yeah, I can't see. I've got these rings around the lights, and it's blurred, and
About how long now have you noticed that?
It's been about 2 days.
2 days?
Yeah, it's been pretty bad.
Okay. Any other
Well, for the
problems?
irritation, excuse me, over the past few months,
Okay.
this eye's been bothering me. I can't see too well.
What was his visions when you checked them?
For the right eye, he could see down to 2100. And that was with glasses. Without glasses, it was 22. But for the opposite eye, saw nothing.
Okay. So what I'm going to do is I'm going to take a look at you with my slit lamp. So all I need you to do, see my slit lamp, please. Just look straight ahead at me. I'm going to hold this bright light up to you, moving real close to you. And then I need you to look up, and then down, and then over this way towards Miss Darian.
I'm sorry, I had a little trouble
That's
moving
okay.
my eyeball.
And then let's move over to this one and up, down, over to Miss Darian, and over towards your right. Okay, so in your left eye, I'm definitely seeing the start of some cataracts going on. Do you know what that is? Any family history of that?
No, I don't.
No family, any
His grandmother.
grandmother. Okay. Do you
She
know?
had gray
With the
eyes.
gray.
She had the gray
Yeah.
eyes. Okay.
She didn't see too well either. Made some amazing fried pies. Excuse me. I was scalped when I was a teenager.
Okay, so with your cataracts and with you, you're probably at about a level or grade 1. There's 2 different grades, grade 1, grade 2 being the more severe. Yours isn't as severe yet, but it could happen. So for right now, there's 2 different things that we can do. We can either change your glasses prescription and make it a little bit more sharper for you,
Okay.
or if you're wanting more of a permanent fix, a solution, it would be to go ahead and have the removal, the cataract surgery. And what that means is they will go in and your IOL, which is your intraocular lens implant, they will go in and replace that.
Mm-hmm.
And they will place that with a new lens. And it could be either a monofocal or a multifocal. And the mono being you only see either up close or far away, and the multi would be for both purposes.
Okay.
So any questions as far as that goes? For the surgery itself?
What about after the surgery? What am I looking at?
So after the surgery, it usually takes about up to 8 weeks. And you're gonna immediately start wearing sunglasses as soon as you get out of surgery. You'll be discharged that same day. You don't have to stay overnight or anything. Then they should put you on an eye drop regimen, and there'll be a couple different drops, one for infection, one for inflammation. You'll take those as prescribed. And then they'll schedule you a post-op appointment, and you'll come back and see me.
Okay.
And I will take a look, see how you're improving, see if there's any new problems that you've noticed, and we'll just kind of go from there.
Okay, because I can't be out of work too long. I mean,
We won't.
I got 13 children to
Oh
feed.
wow, you've had your hands full.
I do.
But
Little
no.
old Beth, she's...
You should see
Not
a pretty
liking this.
drastic improvement within probably the first couple days.
Okay, good.
So whenever you come back and see me, I'll be checking for any new floaters and that kind of thing. But
Okay.
from now until your scheduled surgery date, if any new problems come up, you don't hesitate to call me and come in and see me again.
Okay.
I am going to go ahead and prescribe you some antibiotics. It looks like you've got a little bit of conjunctivitis in that same left eye, so we'll go ahead and give you that and get you cleared up before they can get you in for surgery, okay?
Okay, that's great. Well, thank you very much.
Not a problem.
Barbara and Danny, thank you. I appreciate it.
Hi, Miss Bouchon. My name's Sarah. I'll be your nurse today. Alright, can you tell me how you've been doing?
I've got a lot of pain in my ear.
Okay.
It feels really full. It's really hard to hear out of. So if I can't hear you, I'm sorry.
Is that what brought you in today?
Yeah.
Alrighty. Before we get started, can you tell me your name and date of birth?
Darian Bushong in 9/15/95.
Alrighty. So how long have you been having these inner ear problems?
Technically, since I was a baby, I
Since
had
you
a
were a
lot of ear infections and I got tubes put in, but they
Okay.
fell out eventually.
Okay. Awesome. So you didn't have any problems with the tubes coming out of your ears or anything?
Just a couple times they had to re-put them back in,
Put
and
'em
then they just kind of gave up on it.
in.
So.
Okay. Well, have you noticed any drainage coming out of your ear?
Yeah, quite a bit actually here recently.
And you said there was some pain as well.
Yeah.
Okay. Can you rate that for me on a scale of 0 to 10, 0 being none and 10 being the worst pain you've ever felt in your life?
I'd say probably around a 7 or an 8.
A 7 or 8, so it's pretty severe pain.
Yeah.
Okay. Now, have you been on any medications recently? Any new meds?
No, I just take ibuprofen every once in a while, maybe to help with the pain.
With the pain? Okay. Right. And have you been cleaning your ears out with anything?
So I know you're not supposed to, but like I can't stand my ears to be dirty, so I use Q-tips.
Q-tips. Okay. Have you been using anything else?
A finger.
A finger? Okay, well that's pretty normal, so that's alright. Okay. And have you been on any medications for your ears recently? Seen any other physicians? Okay. I'm just making sure they're here. Alright, have you been running a fever or anything with this?
No, not that I know of.
Okay. Awesome. That's good. So I'm just gonna take a look at it real quick. Let's see. Okay. I see the drainage and everything. Alright. Well, I will go talk to the physician and I'll be right back in with her and we will check it all out.
Okay.
Thank you.
Babs, I feel so happy. Ever since I got those cataracts removed, I've been to medical school, and my life has just been for the best.
So you're better now.
All right, let's go see
Let's
my
go
patient.
check on this patient.
Well, how are you doing?
I'm doing all right. How are you?
Oh, I'm doing okay. Now, that seems to be the problem? Nurse Babs here was telling me that having a little trouble hearing.
Yeah.
Can you hear me okay?
Yeah.
Okay.
Right there. I could. Yeah.
Okay. Let's see.
Here's the chart.
Okay. So you have a little bit of pain.
Huh?
Pain.
Yeah.
Okay.
And she's been having a little bit of drainage too coming out of it. She could use some Q-tips to clean it out with.
Well, let me look and see what we got here. Oh, look, it's all up in the pinna and everything. Wow. That's quite a bit. Quite a bit. You said it hurts.
A lot.
Okay. Well, the thing what we can do, well, I want to do a test first. We're going to do the Weber test. Nurse Babs, you can hold it
All
for a
right,
second.
yeah, I can do that for you.
Just gonna, now I'm gonna hit this tuner fork, and when you stop, when you don't hear it no more, you let me know, okay?
I can't hear nothing.
Okay.
Oh, still nothing.
Okay. All right. What I'm gonna do is we're gonna put some eardrops in your ears to kind of loosen that cerumen up. Yeah.
What is cerumen?
Earwax. I apologize. I'm new to the whole doctor thing.
That's okay.
We're gonna do some eardrops, and then I'm gonna get my little special spoon, and we're gonna get some of that earwax out. Okay?
Okay.
Okay. You got the eardrops, Nurse Babs?
Yes, I do. I have one in my pocket.
Okay. She's just gonna give that to you.
Just slightly over.
And it is warm, body temperature, to make sure it's not too cold. We don't want no discomfort. All right. Now what we're gonna do is I'm gonna take my spoon. We're just gonna start digging that earwax out of it. There we go. There we go. How's that?
Wow.
Can you hear it a little bit better
Oh
now?
yeah. A lot better.
Well, good. I'm happy to hear that. What I'm gonna do is I'm gonna prescribe you some more drops, and just to make sure we got everything out from the inside of your ear.
How many times a day should she put those in her ears?
About 2 to 3 times a day.
2 to 3 times a day? Okay,
Yes.
in the morning and the evening?
Yes, exactly. And refrain from using any more Q-tips or fingers or toes or anything like that, okay?
Okay.
Okay. Well, what did you say your name was again?
Darian.
Darren. Darren, it was so nice to meet you.
Okay. Thank
All
you.
right.
Alrighty, I'll be
We'll
back
take
in a minute with your prescription and we'll talk about your medications.